Hi, it's Pinky here. Let's talk about dummies or pacifiers and baby sucking needs. Now, how often, as a breastfeeding mum, have you been told he's just using you as a dummy because your baby's quite frequently feeding? Now, in the beginning, your baby's feeds do seem to take a long time because your baby's practicing coordinating his sucking, his breathing, his swallowing, and he's getting to be, really efficient at breastfeeding. So he's not using you as a dummy, but it's better if you don't introduce an actual pacifier because often you'll think, well, maybe I should just give him a dummy so that he sucks that instead of sucks on me all the time. But he's also building up your milk supply and establishing that. So in the first few weeks as you breastfeed, your body is creating surges of prolactin, by his sucking, these surges of prolactin, which are your milk making hormones. So your body's also doing more development. Your breasts are developing more in those early few weeks. And so you'll have more prolactin receptors in your breast. You'll have a better um, prolactin response. You'll be increasing your milk supply. So please don't give a dummy in those early weeks. And when we think about it, do we need to give a dummy? Could a dummy be helpful? Sometimes a dummy can be helpful if you've got a really copious milk supply, and babies often do a bit of finger sucking, and that's okay too. You'll hear older ladies possibly saying you can get rid of a dummy, but you can't get rid of their thumbs or their fingers. And again, watch your baby. If your baby's, quite a few weeks old, and you can get some babies are sucking their thumbs in utero. This is what they're doing. It's a comfort thing for them. It's something they learn to do. It's a tactile thing. Once your baby's up and crawling, he's probably going to be using his hands on the ground to help with his crawling. He's going to be exploring his surroundings, so he won't be just sitting there sucking his thumb. Again, be careful though. If your baby's doing a lot of thumb sucking, could he be sucking his thumb when he actually could be sucking a breast? Remember, there's no calories in the thumb. Now, something about dummies and teats, they require a different sucking action from the breast nipple. So by offering a dummy in the early weeks before breastfeeding is well established, you could actually create some breastfeeding difficulties or make current breastfeeding difficulties a bit more challenging, such as effective latching. Because if your baby's unsettled and he's had a good feed but he seems to want to suck, sometimes offering your clean finger to suck on is actually better for a few minutes than a dummy because, often just a little suck will help him calm down. But if he's got this milk supply coming along and he wants to suck more but he doesn't actually want to eat, this can be a bit frustrating for him. But a finger holds your baby's tongue flat in a similar position to the breastfeeding, whereas the dummy encourages sort of a thrusting action with his tongue. So, generally he doesn't need to suck much more than on the breast, and your milk supply will settle down. So he'll be able to suck on the breast for comfort. Remember, there's no calories in a dummy, so popping a dummy in your baby's mouth when he's actually trying to signal hunger, often people are asked to stretch out feeds. Don't let him feed any more often than, 3 hours, 2 hours, whatever. Stretch him out so that your breasts fill up. Well, this is actually rubbish because your breasts are always going to be making milk, and an empty breast will make milk more quickly than a full one. So that's actually bad advice. And it can have a negative effect on your baby's weight gain and on your milk supply. So in the long run, dummies can create more trouble. Sometimes a dummy's okay just to get your baby to settle down or stop crying or whatever, depending where you are. Sometimes you're in the car. Sometimes you do have a big milk supply, and popping a dummy in for a few minutes for your baby to settle, that can be helpful. But again, be really careful about offering dummies. If your baby's doing a lot of thumb sucking and self-comforting, offer him the breast as well and just see. Now I had one baby who did suck her thumb for a little while, just for a little while. But I actually had quite a copious milk supply. She was my third baby, and she obviously didn't want to be comforted by a full breast, so she would pop her thumb in her mouth and suck for a little bit, and then it would come out. But and I was always holding her when she did this. But sometimes babies who are sucking their thumbs when they're very young and going off to sleep, sometimes it can mean that they're actually missing out on some calories. So just keep an eye on that. That you're doing as much comforting as you can do to do that. And if you do use a dummy, to comfort your baby, watch his cues very carefully. If he spits it out, don't keep plugging him up again, because you run the risk of blocking his only means of communication. He might need his needs met in other ways. He might like to be fed, he might like to be played with, he might like to be talked to instead of just sitting there with a dummy plugged in his mouth. So be really careful if you do decide to use a dummy. Ideally, it's great if you don't need to use one, but occasionally people, do use a dummy just to settle their baby for a bit, or they might take it when they go out in the car just to settle that baby. So be really careful, watch your baby's cues, and remember, there's no calories in the dummy. And this intense sucking that your baby does when he's very little, and he feels like he is feeding all the time and using you as a dummy, that's going to stop. Once, if you surrender to his needs and let him have as many feeds as he wants to when he's little, your milk supply, your set point, will become higher, so he'll get a full tummy more easily. And also, he's going to become a really efficient feeder. So very soon he's going to take quick feeds and he'll be able to empty your breast quite quickly, and that will be, good for you, good for your supply, good for him, and you won't have had to introduce a dummy.